Hello, everyone. Welcome to this webinar entitled Building a Location Strategy for Market Development and Planning Departments. I'm Esri Garrity, and I'm the Chief Medical Officer and Health Solutions Director at Esri. And I'll be joined today by my colleague, Jared Schultz, our Technical Specialist for Health and Human Services. Before we get into the webinar, I wanted to start with a few housekeeping details. This webinar is being recorded, so as long as you've registered, you'll be sent a link early next week, providing you with access to the final recording. For the duration of this webinar, you will be in listen-only mode, but we do want to hear from you. So if you have questions or comments, it's preferable to put them into the questions box on your screen, but you could also put them in the chat box if you like. I'm going to monitor both places, and we'll address your questions at the end of the presentation. I expect the content of this presentation to last for about 50 minutes. Okay, so let's go ahead and get started. This webinar is the second in a series of 3 on market planning and marketing functions for hospitals and health systems. The first webinar delivered last month, called The Results-Oriented Provider, is now available, and it's available on demand at the URL that I've listed here. Now, this 30-minute recording was really intended to give the executive overview of the series, showing what's possible when you view your development strategies through a location perspective. Today's webinar is going to get a little bit more technical and provide you those details for using a location strategy for the market development and planning portion of the work. While the third webinar that's coming next month is going to get technical on the marketing aspects of your work. And we really hope that you'll take the time and view all 3. I've also published a blog on how to effectively grow your health system footprint, which is available online. Now, as I said last month, but I think it actually sums up our purpose in presenting this series pretty well, if this is your market potential and this is your current market share, then this area in green is where we can help you. We can show your organization the tools and methods that'll streamline your decision making as you're working to optimize your footprint and your service offerings in an effort to capture as much of the market as possible. Now, in order to show you how we do that, the next hour is planned as follows. I'll spend 7 to 8 minutes providing an introduction to the concept of using location as a unifying and value-based strategy to grow your health system. Then Jared will give you a technical demonstration so you can see the process in action. And we should have about 10 minutes left at the end of the hour to address questions. At Esri, we believe that a geographic or location-based approach, in other words, the science of where, can unlock data's full potential in every organization. And this is especially true in health, since we know that a community's health outcomes and their access to healthcare services are just not the same from one place to another. Today's technology advances mean that we can do things with geography now that weren't possible just a few years ago. And it all begins with answering the fundamental questions of where. Where's the problem? Where is it changing? Where should we locate a resource? You know, if you listen closely, you'll come to realize that people are always talking about location in one way or another. And I being the type of person I am, I actually looked this up, and I learned that the word where is the 110th most commonly used word in the English language. So I'd say where is a pretty important concept. But it is more than what is where. We can use geography to answer other key questions like, why is it there? Which implies the use of analytics to get at root causes and answer big questions. And then my favorite question is, why do I care? To me, this is one that's all about action. We answer those first 2 questions in order to determine the most efficient use of our time and resources. But we don't stop there. We also need to think ahead and ask, how can I prepare? This is about predictive modeling and figuring out where will something happen next, like changes in population demographics or disease burden in different communities. When you begin with geography as the common denominator in your data, then you have a great method for data integration. This is potent because you can bring together many different kinds of data, from satellite imagery to different kinds of sensors like climate, pollution, or any number of IoT medical devices, as well as healthcare data, public health data, demographic data, commercial spending, insurance coverage, and much, much more. All of this leads to a deeper level of understanding that not only improves decision-making, but facilitates planning and your design of interventions. In fact, geography as a science really provides the content and the context of our whole world in a way that helps us to understand everything. A geographic framework enables you to go from data integration of multiple complex data sets to create understanding that drives better decision-making and action to accomplish and measure the desired impact. It's powerful. Just consider the idea of scale. Different questions are naturally going to require different levels of geographic consideration. For example, you may be reviewing the entire region covered by your health system, examining how each facility is performing relative to the others and where the major competitors are located, and if you may be leaking business to those competitors. It's also useful to dig into the circumstances around a single facility within the system, like where are the patients coming from? You might do this for your entire suite of services, but you might also review utilization patterns of different services, like emergency services, pediatrics, or your cancer center. And you can be very agile when you use geography to consider multiple approaches easily, like service area definitions. You can switch seamlessly between zip code-defined service areas, patient-defined service areas, or even drive time service areas. Each method gives you new insights about where your patients are and what they're willing to do to access your facility. To better understand your customers or your patients, you're likely going to need to understand the communities or neighborhoods in which they live. That might mean that you need to see census tract or block group information on data like market segmentation or area crime rates. And there are times when you really need to know the exact location of something so that you can take action. For example, you need the practice locations of out-of-network physicians in your planned expansion areas so you can tailor your recruitment strategy. Well, Jared is about to show you how you can pull together massive amounts of data concerning your own health system and your competition, the population you serve, its demographic, spending, and behavior characteristics, as well as economic information on insurance mix or service demand and utilization. All of these data sources can be made sense of to determine the best areas to expand your facilities or specific services. You'll also see how further analysis of those potential expansion sites against how you rank those against your own system priorities can then help you to get the best information possible to make those critical resource decisions. So Jared, why don't you take over the webinar at this point?
Thanks, Dr. Garrity. All right, show my screen. Okay, so now let's walk through a typical strategic planning workflow scenario that could be easily implemented by a healthcare organization using different components of the ArcGIS platform. Market development and planning executives need timely insight into the performance of their operation to drive growth, quality, and cost savings across their health system. A typical analysis workflow can include one facility, a regional network of facilities, or an entire health system, which often covers a large geographic area and provides a variety of services. To support informed decision-making, planning analysts need to include multiple market factors and performance metrics in their analysis and share the results with leaderships to quickly identify areas for improvement and test different scenarios. A location strategy and location-based dashboards can quickly deliver the type of executive-level insight decision makers like the Director or VP of Planning or other chief officers in your organization need to understand the current projected future state of their operation. Strategic decisions to drive growth need to be based on measurable factors, such as the total market share being captured by their health system across an entire region. This performance metric is depicted here in the regional market share total gauge that indicates 69.4% of the total market is being captured by the entire system. And that the largest market share, 19.3%, is captured by Hospital 7, which is located in the Chicago metro area, right here. While this helps us understand the overall situation, the metrics need broken down further, not only by geography, but also by time to provide precision. The third panel in the dashboard is a bar chart showing leakage across the last 4 quarters. Leakage here is defined as the percent of potential patients that have chosen other facilities outside of a health system. This type of data is often obtained from commercial sources. It can be combined with spatially enabled data from a health system to provide the most complete view into an overall market. In this example, an executive can see leakage declining to its lowest point in the 4th quarter, this is not just a coincidence. This health system reduced leakage by using geographic analysis to select the best new provider location that served the greatest number of patients. A comprehensive location strategy provides this type of big picture view into operation, locating underperforming areas and illustrating patterns in the patient population. Taking a spatial approach also allows health systems to better define their overall service areas using the exact locations of their patients. Pictured here with red primary service areas and blue secondary service areas for each one of the individual facilities, pictured in black. These targeted service areas often overlap and vary based on the overall population density and accessibility of each facility. They can be easily overlaid with other factors to answer vital business questions like, how far are patients willing to travel? Where are the core markets where a health system has been most successful? And what areas have the most room for improvement? Moving from a big picture regional view to a facility-based view of operation helps organizations not only identify problem areas, but highlight localized contributing factors related to patient satisfaction. Here we see satisfaction scores across 4 quarters ranging from 0 to 100. Scheduling wait times, again across the 4-quarter time period, and the percent leakage. Increasingly, healthcare providers are being evaluated and in some instances financially penalized for low satisfaction scores. So anything that improves the customer experience can have considerable impact on utilization and the subsequent profitability of individual facilities. Scheduling wait times defined here is the lapse time in days from the moment appointment is scheduled to the time of the actual appointment, helps illustrate the overall ability of a provider to quickly see a patient, which can have significant impact on patient satisfaction. In this example, the user can see that Hospital 7, which had the largest overall regional market share in the first dashboard, also had a very high rate of leakage in their service area, indicating an opportunity to capture additional patients in this metro area. Combining these regional and facility-based metrics with service areas, major competition, pictured here with the white hospital symbols, patient locations, pictured here is a heat map on a scale from yellow to blue, with yellow indicating the most dense patient areas, with additional demographics to provide market planning professionals the insight needed to support data-driven decisions in all aspects of their operations. Health systems can in turn improve access, capture additional market share, enhance patient experience, and develop a growth strategy anticipating changes in the market before the competition. These are just a few of the factors that need to be considered in a healthcare market development and planning process. So to help illustrate how geographic information systems can be applied to address these needs and generate these types of spatially informed executive dashboards, I'm going to walk through a typical workflow using Esri's Business Analyst desktop and web-based tools, which enable an organization to leverage location-driven market insight to make better decisions. On screen, you see Esri's Business Analyst desktop interface, which is designed to accommodate healthcare analysts regardless of whether they have any prior GIS experience. It provides a set of guided tools that accommodate typical market development and planning workflows with extensive documentation, helps, and examples. One of the first steps in a location-based analysis of a health system's operation is putting points on a map. These points include the location of facilities in the health system, as well as the location of each patient. Once these points are mapped, an analyst can start exploring different methods to calculate service areas around their facilities and explore overall markets. Traditionally, service areas have been defined as collections of zip codes or counties where a health system anecdotally knows its patients are coming from. Here we can see those typical types of service areas that don't always correspond exactly to where the patients from a facility are coming from. This method for defining a service area often oversimplifies their market and fails to provide the detailed insight needed to truly understand why patients are choosing a particular facility. Using the location of each patient to drive this process allows users to quickly refine the service areas to encompass where patients are located. Using a simple wizard-driven interface, analysts can determine which patients are going to each facility. Here we see the results of that process where every individual patient is connected with a line to the facility it's going to, and that line is then color-coded individually. They can also determine how far they're willing to travel using these same tools. Here we went and taken each one of those connecting lines and then color-coded it based on the drive time, ranging from less than 15 minutes to 60 to 90 minutes. And they can also determine how accessible each of their facilities are by creating drive time service areas. So here, go ahead and turn our patients off so we can see this a little bit better. Zoom in. And now for facility 7, we can see this drive time service area that's been generated around the facilities. It provides 15, 30, and 45-minute drive time analysis that's based on streets, speed limits and directions, and other information that can be incorporated in, including real-time traffic and the time of day. This type of analysis can be done for different types of travel modes, depending on the area of the facility. Combined, this information can be used to generate service areas based on the proximity of current patients to each facility. So here, let's use our wizard-driven interface and calculate a new trade area. I'm going to calculate this trade area, and I have a lot of different options to generate the types of service areas we just saw, whether they be drive times or simple rings and buffers. I'm going to do a patient-derived service area here. And I specify where the facilities are located at, where the patients are located at, as well as linking them to each facility. How I want to calculate my service area. Here I'm going to use the number of patients and generate a primary and secondary service area representing where 50 and 75% of my patients are coming from respectively. A few other options that I can choose. Then I can also select a number of different reports for each one of those areas. The primary areas, the secondary service areas, and the entire region. So let's go ahead and select all those options. And then I'm presented with a number of different reports. Demographic reports that I can pull from. Here I'll do a demographic and income profile. Executive summaries, medical expenditure based on consumer spending, and actual market segmentation that describes each of those individual communities. These are just a few of the reports that are available here. But I went ahead and ran these reports prior for the sake of time. So let's go ahead and cancel out. And we'll turn on the resulting service areas. So these resulting areas and reports help the user to not only understand who is coming to each facility and why, it also serves as a starting point to mine this information for more in-depth analysis of the patient population and overall market. The detailed reports for each one of these service areas provide insight to the types of communities these patients are coming from. So let's go ahead and look at this Tapestry segmentation area profile. I'll explain this a little bit more in a moment, but what these numbers are showing you is where the current and population is for each one of these facilities. In this example, 14.3 of all patients in the primary service area for Hospital 3 are coming from households located in an area classified as professional pride. See that right there. This is one of 67 unique market segments in Esri's segmentation system called Tapestry, which helps users understand customers' lifestyle choices and purchasing patterns with detailed demographic and socioeconomic characteristics sourced from leading content providers. So let's dig into professional pride a little bit more and see exactly what that means. So when I explore this market segment in more detail, I see it has a median age of around 40, with a relatively high median household income. Typically, the consumers in this area are highly educated and very digitally connected, which provides insight to move forward with developing a comprehensive growth and marketing strategy. By plugging in all the spatially enabled market information into our strategic planning process, we can determine overall market penetration across the region based on our current patient population. Let's go back to desktop here. And turn off our market penetration map here, which is now showing us, based on where each one of our patients at, how well we've penetrated that individual market based on what we know to be the potential patient base in that area. We can also locate ideal markets that have similar demographic profiles across the region we service. So here, we're seeing areas with similar characteristics at the markets that we've penetrated and that match our ideal patient profile. Equipped with this knowledge, we can also classify all existing markets into 4 different categories based on their strategic growth potential. The resulting 4 market categories range from core market designations, orange areas on the map that indicate where we should aggressively pursue, as well as areas we should completely avoid, gray areas on the map. In this example, you can easily locate the 89 zip codes that represent core market areas across the region that match our ideal patient profile. In some instances, we may not have heavily penetrated these areas to date. There are no developmental markets resulting from this analysis, but plenty of areas classified as niche where we may be able to pull some additional patients and areas we should avoid altogether since we've had very limited success in these markets to date. And they may also exceed the distance that our patients are willing to travel. Now, this set of classified markets can serve as a preliminary set of locations to expand our operation to capture additional market share and address some of the issues we're seeing with low patient satisfaction scores and long scheduling wait times that could, in part, be caused by capacity limitations. When planning an expansion, we want to start with these target markets, but we need to consider additional factors. One potential factor to consider is complementary service providers in the area. With a few on-screen clicks, I can quickly generate a point layer of all the medical offices and clinics in my area of interest. So let's go ahead here and pull some business listings. I have options to pull them from local repositories or online. And then I'm going to go ahead and select my location. And I'm just going to use the extent of the current map here, my current analysis. And then I can search a number of different ways here, but I'm going to search based on standard industry codes that most closely correspond to the complementary service providers that I'm interested in. So we'll use the code of 8011. And then I can further limit this down. For the sake of time, I'll go ahead and select all of these. And I have other options to limit down based on size of business and other things. I went ahead and done this before, so let's cancel out. And look at the location of all of our complementary service providers across the region. These locations present opportunities to pull additional providers into a referral network or provide the ecosystem of related service providers that would be crucial to the success of any new facility. Now that I have this information, I can add the number of complementary service providers to each of my target areas, zip codes in this instance, along with their sales volume. So I went ahead and did that, pulled out these areas that I'm very interested in, and now I've color coded them based on the number of providers in each one of those areas. This is useful to locate stable markets with high levels of demand. I can also append other demographic and market factors to these target areas using a simple process that would have normally taken an analyst countless hours of searching and reformatting the data to include it in the analysis. That's also available through a quick wizard-driven interface. I can go ahead here, create analysis, do a market analysis versus an individual site, and append data. I select the target areas, which is my core areas that I've added these service providers to. Select my data source. And then I'm presented a number of different options here of different types of demographic indicators and other things that I can pull from. I went ahead and selected some from a lot of different areas here. But you can see I can pull from consumer expenditure data, income, socioeconomic, demographics, market potential, all sorts of information sourced from leading data providers. After this data has been geographically linked or apportioned to these target areas, it can be used as criteria in the process of refining the set of locations being considered for expansion. So let's go ahead and kind of limit these 89 areas down. So I've got the information that I pulled here. I pulled the current population information, which is actually 2016. It's based on census data, and then Esri statisticians and demographers do a current year estimate, and then they do estimates 5 years into the future also. So let's just look for areas where there's a current population greater than, let's say, 25,000. We're interested in focusing on areas that are heavily populated. And then we want to look at areas with a little higher levels of income. Okay. And then finally, let's go ahead here and look at areas that have a sales volume with the complementary providers of more than 100,000. And you can see every step that I take here, I'm going ahead and limiting the number of suitable areas. So let's go 100,000. And then I can also go ahead here and set my different indices. Our team calculates indexes for different variables, say Medicare payment indexes, health insurance, and other things. So I want to look at 100 areas that are above 100, which is the average. And I also want to look at areas that have a high number of service providers. And you can see now I've went from 89 different potential locations all the way down to 5. Let's go ahead and add these to the map. Let's go ahead and turn off our other layer so we can see this a little bit better. So now I'm returned a result of 5 key areas that meet all the different criteria that I want to move forward for during my expansion here. Well, I'm just one part of a team looking at this potential expansion, and ArcGIS allows me to easily share the results of this analysis with other members of my team who've been tasked with ranking these areas for suitability based on additional criteria. They're going to use Business Analyst Web that provides an even more intuitive web-based interface where they can conduct analysis and easily produce additional reports and infographics, which can be immediately shared with our executive management team to make some final decisions. Let's go ahead and switch over. Okay, so now we've identified our 5 potential areas to expand our operation to help capture additional regional market share. Now we need to consider additional factors to rank the suitability of each location. We already have access to the results of our first level analysis through our GIS portal, which shows us our target expansion areas based on existing patient profiles and the types of communities we have successfully penetrated. The next thing we want to do is create a competition layer so we can factor in the location of competition into a suitability analysis. For this example, we will create a layer of all the hospitals in the region. Let's go here, do another business and facility search, show some more options. Before I was using standard industry codes. This time I'm going to use NAICS codes. And again, I can do keyword searches and a number of different things here, but let's go ahead and do this and search. And you can see I'm returned back a list of a lot of different facilities in the area. I can look for specific names of facilities, types of facilities, further filter by keywords. And you can see every filter then goes ahead and limits my result set back down. Then I can go ahead and save this out into a number of different formats, export it out, and include it in my analysis. Just go ahead here and get that back so we can see our suitability areas. And let's go on to the next step here, which is conduct an actual suitability analysis that includes that as well as additional information. So let's do a suitability analysis. Let's add our sites. So we have all the existing locations that we've already identified. And now I want to add some additional criteria in here to consider in my analysis. I can pull from the vast array of demographic content that Esri has already curated and made available. So let's look at some of that. First, let's look at population. And our ideal profile had a higher median age, so let's pull some median age information here, see what kind of options we have. I'll pull the 2016 median age. You can see I can do numbers, indexes, percentages, whatever I'm most interested in. The next variable that I want to pull from here is in our curated health content. I want to look at health insurance spending. So let's add that to our variable list. And then I want to look at some behavioral data too. And we'll look at the number of individuals that carry the types of insurance that we're looking for. And let's go ahead and apply these options, or we'll actually pull one more piece of information here related to employment. Let's look for areas with low levels of unemployment and apply. And these are just a few of the different options that we can pull here. You can see there's a lot of different categories to choose from. So let's apply these 4 areas here. Next thing I want to do is include some of the original data that was appended to the target markets in the first phase of the analysis. So let's go ahead here and add criteria from the site. And this could be any information coming from any of your existing systems. What I had pulled here was some population growth information from the current year, which is 2016, to 5 years into the future, 2021, and also the total current population. This type of information in the projections that are going out help you locate areas that are not only going to be attractive right now, but are growing and will be very attractive in the future. Lastly, I want to factor in competition by summarizing the number of hospitals already located in these zip code areas that I've identified. Let's go ahead here and add our competition hospital layer and close. And you can see there's so many of these in the areas that they're immediately clustered at this scale. And as I zoom in, they become unclustered and I can see the exact locations of the facilities a little bit better. Well, now I want to go ahead and set my criteria a little bit more. And let's go ahead and look at our median age here. And again, look for areas with higher median age. And then let's look at unemployment rate. It's just another factor I want to consider. I want to look inversely and focus on areas with lower unemployment rates, but it's not an end-all be-all factor. It's just one of the things I want to consider. I want to weight it a little bit higher. And you can see as I change the weighting on individual variables, it adjusts the weighting on the other ones. I want to lock that at 20%. And then finally, I want to go ahead and look at my competition layer to try to avoid some areas that may be oversaturated here. Make sure that it's inversely looking for areas with the lower competition. And let's go ahead and rate that or rank that or weight it at 25%. And lock. So now what I'm returned back here is a resulting data set that I can easily export out and use in other systems, or I can view the resulting table here. So now, as I hover over any one of these areas in the table that have been spatially linked and enabled, I can see the individual score. I can see that 60068 has the highest score of 0.5, and I can see it highlighted on the map. I can see the value, median age of 45.9 for that area, what score it got, which was the highest score since it was the highest median age of any of the areas, and then the weighted score. I can see the same thing for the amount of health insurance spending here, which is pretty high, and then the number of people carrying insurance, unemployment rates, and everything else that I factored into my analysis. As a final consideration, I want to go ahead and explore other factors like crime statistics and access to public transportation in my top ranked area that could have both positive and negative impacts on our operations. So let's go ahead here. Let's turn this color coding off. Turn our facilities, our competition hospitals off too. And let's go ahead and explore some of these other considerations. First thing I want to do is look at crime indices and statistics in the area. So let's go color-coded maps and search for crime. And again, I have access to all the same information that has been engineered into the reports and the data browser that I was looking at earlier. So now I've got some 2016 crime indices, and I'm going to look at a total crime index. Here, I can see at this scale, I'm looking at census tract data, but as I zoom into my ideal area here, the scale of the data is immediately modified. So I can get all the way down to the block group level and then see the crime indexes for the areas ranging from 4 to 51 all the way up to 477, 100 being an average crime index. So there's plenty of areas in this market that I've identified here with low crime rates. And this may be important to, our safety of our patients, our staff, and just overall placement of our facilities. Now I want to look at accessibility. So I overlay transit access layers from Esri Living Atlas, which includes authoritative maps from Esri's and thousands of other users. Let's go here. We'll turn our crime data off. And let's add some more data. We have a lot of different options to import data in different formats, but I'm going to go ahead and access content that's publicly available to users in the Esri platform here. I could access stuff from my own portal, but I want to go to my public gallery here and just do a search for transit access and see what kind of data sets are available. I can see that a lot of other providers from different metropolitan areas have provided information out that I can use without having to generate this stuff on my own. Here I can see a transit access layer in a format that's easily consumed in GIS. So let's go ahead and overlay this layer. It zooms out to the scale of the data here, which covers a lot of different areas. So let's zoom back into the Chicago area that we're interested in, and specifically to our ideally suited location. Let's go ahead and turn our legend on here to make sense of what exactly we're seeing. And for this area, what I'm seeing is the individual transit stops and the accessibility. This accessibility is a lot of different coverage across the area, ranging from a quarter-mile walk to 6/10 of a mile walk, and even closer in a lot of these areas that are right next to the stops. This tells me that public transit is readily accessible across the entire zip code, which when combined with the low crime rates and all the other factors my team has considered, make this an ideal area for our expansion. Well, now I'm ready to present my findings to our executive team. So first I'll generate some reports for the suitable area. Let's go ahead and turn this transit access layer off. Turn the results of our suitability analysis back on. So now we're presented with the suitability scores for each one of our areas. And let's dig into the particular area of interest here a little bit more. So if I go ahead and click on this facility, I have an option to generate a number of different reports. And let's do, we'll do a medical expenditure report to see what kind of medical spending is going on in the area. You can see I can generate these as a PDF or an Excel spreadsheet and run my report. Let's take a look at this report. We'll zoom in a little bit. Now I can see some of that demographic information that I had before for current year and projected in the future. But even more useful, I've got a breakdown based on potential spending indexes, average and total amount spent across different types of medical care, as well as a breakdown by different insurance providers. So if there's a particular provider or type of service that we're offering, we can get some more information about that with these reports very easily. In addition to these standard reports, I can also generate my own customized reports and generate default and custom infographics in a number of different formats. So let's go back here and look at one of these infographics. And by default, I'm given some key facts and education information, but I want this to align a little bit more with the Tapestry data and some of the other stuff that I had been doing earlier. So now I can go ahead here and look at the breakdown of those key market segments and have quick access to them through this infographic. Education level, employment, businesses, income, all sorts of different things. And I can customize these infographics a number of different ways with my organization's logo, different data sets, anything that I want. And then I can export it out to different formats to put into different presentations and resources and print them out. So whatever format I need is easily accessible. So now other members of our team can use these same tools and data to explore existing facilities and real estate in this area, determine the best next step to strategically expand our health systems operation. Different options for expansion could include building a new facility, acquiring an existing competitive facility, or adding additional provider locations to our network in the identified target area to increase overall network accessibility and options with the goal of capturing additional market share and improving the overall customer satisfaction. With that, I'll turn it back over to Dr. Garrity to wrap everything up and open the session up for questions.
Thanks, Jared. I'm going to have you stay unmuted and assure me that my screen is being seen. Can you see it?
I can see it.
Perfect. Thank you so much. Now, before we move on to the Q&A portion of this webinar, so you still have time to enter any additional questions you might have, I just want to recap some of the key messages that Jared and I have shared. I'm going to go back to my simple graphic here that shows you that our area of focus is on your market growth and optimization strategies. But in fact, GIS tools are also going to help you determine the overall market potential and your market share. I showed you how applying a geographic perspective can help you make sense of massive amounts of complex data and provide important new insights into your business. Then, Jared demonstrated the tools using a scenario in which multiple data sets were integrated and analyzed to find your potential areas of expansion. He then performed additional analysis on those potential sites, adding in data that would maximize the market potential for the health system, like areas that are further away from competitors, and that allowed the ranking of some of the options. Then, the top options were further explored to ensure that other characteristics of the place were aligned, like lower crime areas and good access to public transportation. So if you'd like to learn more, I want to invite you to visit our website at go.esri.com/planning. And while you're there, be sure to check out our story map that provides an interactive experience summarizing this entire topic. And remember too that this is a 3-part webinar series. Our third webinar is scheduled for May 18th, and registration for that event will open soon. And as a registrant of this event, you're automatically going to get an invitation to the next one. And again, webinar 3 will provide the same kind of technical detail, but it's going to be focused on the marketing aspects of your work. In other words, how can you leverage geographic information to drive more patients to your facilities and services that this webinar helped you define and expand into. Okay, so now let me get to some of your questions. And I think, Jared, these questions are for you at this point. So the first question that we have for you is, what data does your system provide, and can we import or somehow use our own data?
That's an excellent question. Inside of the Esri demographic content, we source data from a lot of the leading providers. We have the updated demographics. Of course, it's built off census data and other sources, our Tapestry segment data, market potential, consumer spending, retail marketplace, business listings, traffic, crime, a lot of the stuff that we saw, but I did not anywhere near cover all of it. All of our data listings and methodologies are available online, so you can dive into them a little bit more. But you can also pull in your own data, adding it to the individual areas based on where your patients or facilities are at. And there's a lot of different methods to import that data. You can take data directly out of Excel and publish it out to your GIS system. You can pull in spreadsheets directly in desktop or link directly to some of your other enterprise systems. So there's a lot of options there.
Thanks, Jared. So I think that this next question actually sort of was a follow-on to that question, thinking about if an organization wanted to use their own data, does it remain private, or are others going to be able to see it? Because I know you mentioned that there are desktop tools and web-based tools, so I think if you can address that concern.
Oh, that's a pretty common question that we get. With the ArcGIS platform, you have a lot of different options. You can run your analysis on desktop or in a public cloud or a private cloud environment. You control the sharing of all of your information, and by default, nothing is being shared. And there's all sorts of different levels of security you can put in place through these tools. So yes, you can keep all of your information internal, not share it, host it in a number of different ways, but you're in the driver's seat on that. So nothing is going to have to be shared with a larger user community unless you so choose to do that.
Great. Now, Jared, I think this question you and I can potentially both answer. I'm going to give you the first shot at it, but I'll just say up front, we need to be very fair about this one because I know you and I are both a little biased. But the question is, are there any other competitors that are able to provide what Esri provides?
Well, again, that's a good question, and of course we're a little bit biased, but there's a lot of other providers out there in this space that offer bits and pieces, whether it's going to be, different demographic or psychographic data, market segmentation information, maybe some limited GIS analysis and visualization capabilities. but I'm hard-pressed to think of any other providers out there that have the complete ecosystem of services ranging from desktop, to server, to the web, with the content, the projections out into the future, and all of this engineered in a way with a large user community, wizard-driven interfaces, and multiple ways to access this.
Well, Jared, I think you said it better than I would, but yes, I'm biased, but we are the world leader for a reason. But you're right, there are other competitors that can do certain portions of the things we do. I think our advantage is one that we've put it all together, and it's kind of like if some is good, we provide more of everything.
Yeah, well, one add-on to that, Esri, as I had mentioned when I was pulling that transit access data, a lot of our competitors may focus just on one area, maybe a healthcare or related areas, where we serve people in local, state, county government, retail, transportation. So we automatically have access to this rich user content as well as the Esri Living Atlas that allows you to not have to go out there and source and reformat your data, but have it instantly accessible to you from our user community. And a lot of users from all of our industries find that as a very valuable aspect of what we have to offer.
And it goes to something that I say to people all the time, that although Esri serves over 50 different industry areas, health is one of those industries that's extremely cross-cutting. So it could be a value add for our health users to pull those data sets like you did for transportation, or from public safety type officials that are reporting crime data, or school and education data. Health just encompasses so much in our lives. So others may consider that an advantage to serve many industries. Now let me ask you this question. Somebody would like to know how much training is required to be able to use these tools?
Well, the different levels of the tools kind of require different levels of experience, not necessarily as a GIS person, but maybe as an analyst, somebody familiar working with this data, knowing these concepts. So with these wizard-driven interfaces and these tools and the extent of our user community, you can go online and find countless numbers of online training from our own site, YouTube videos out, GeoNet user groups, discussion boards, and other types of things, so that you can have a quick insight into this. Self-paced training. Esri offers instructor-led courses, a lot of different things. So I would argue that to get started using these tools, you would need very little initial training, more understanding of your own operations and data, and then use some of the resources that are available and self-paced to be able to walk through these things and learn them as you go. You don't need to understand how to do every single thing that I've done, but to be able to go in there and start looking at the individual things that matters to your organization. I think most groups are already going to have the staff that they need to move forward with that.
Well, that's pretty reassuring, I'd say. But you mentioned something about knowing your own business, and that may come into play with this next question, because I'm curious too. In a couple sections of the webinar, you were tinkering with different levels of different variables. And so somebody asked, how do you know what weights that you want to use in your analysis?
Well, there's a kind of a couple different questions there. The different levels of the data, we store the data all the way down at the block group level, and then use block centroids in order to geographically apportion it to our units of analysis, whether they be zip codes, block groups, or counties. And as you saw there, as I zoomed in and zoomed out on some of my maps, I was presented data at different scales and levels. As far as determining the individual threshold values, the weights that I'm going to use in my analysis, that's really specific to an organization. It depends on what kind of lines of service that you're offering, what your ideal patient profile is, what that demographic is. All those things are probably known by many people in your organization already, but they just need to be put into this geographic context to inform your spatial analysis.
Well, Jared, I have one more question, and then I have a final question for you. Somebody's asking, two-parter, how was travel calculated to the facilities, and did you have access to a client provided, or was this public information? So maybe the first one, how is travel calculated?
Again, and I would argue that this is another Esri differentiator here. The travel that I had calculated, I did it a number of different ways in the demonstration. First of all, I looked at each one of the individual patients and linked them to a facility, and that gave you those kind of connecting lines showing the information. Then I went ahead and looked and calculated the distance, and both the distance in miles as well as the travel time in minutes from each one of those patients to each one of those facilities using one of these simple wizard interfaces, which showed me how long they had to travel and how far they had to travel. And then I also did the drive time service areas around each one of the facility, which simply went in and looked at the facility, the street network, the speed limit. I didn't set a time of day or include traffic in there, but then that generated that irregular drive time service area around it. And that information was not client provided. Of course, the location of the individual patients would have to come from a client, but the street network and those analysis routines and algorithms that are in there are just kind of baked into the ArcGIS platform for you to be able to use.
Absolutely. And of course, I think it's important to note that all of the drive time calculations are based on authoritative street and road network data that's updated on absolutely regular, in fact, very frequent basis. So you always feel like it's up to date. I hesitate to say daily because I'm not sure of that, but it's updated quite regularly. And I think it's important to mention, Jared, I don't know if you want to say anything more about this, but in this particular case, most of the data that we used was real data, but in terms of the health system data and some of the satisfaction and leakage information, some of that was made up for demonstration purposes. Yeah, I think most health systems are probably going to want to keep their growth strategy under wraps, and so we didn't have that data available, but we wanted to show you the concepts. And my last question for you, Jared, is what's your favorite tool that you showed today?
I love our newest tool, which is the Business Analyst Web, and being able to go in there and do the suitability analysis and create these presentation-ready infographics and reports. Having come from this industry in the past I was more on the government side, but spending inordinate amount of times hunting down data, reformatting that data, and then trying to, link it to my area of analysis, whether it be a zip code county or some irregular service area, we spent a lot of time. These tools just make it so easy to walk through that process. I think that that's by far my favorite piece of what's going on here.
Well, thank you so much, Jared. Well, for everybody else not seeing any additional questions, I'm going to go ahead and wrap it up. And we look forward to helping you achieve success in your market planning and marketing activities in a way that truly only a location strategy can provide. Thanks so much for joining us today.